Dr. Feroze Sidhwa, thanks for joining us on BBC News. This week marks the one-year anniversary since the October 7th attacks and the Israeli response to that. The Hamas-run health ministry puts the death toll in that year at just over 42,000. Israel says over 10,000 of those are Hamas fighters. But you've been to Gaza, you've worked there, and you think the death toll could be a lot higher.
That's right. Me and 98 other American healthcare workers who've been to Gaza since October 7th wrote a letter to the Biden administration. Actually, we wrote two, but the most recent one was on October 2nd. And in that letter and the appendix that's attached to it, we detailed why we think the death toll is certainly much higher than that. The Hamas, like you mentioned, the Hamas government has a Ministry of Health in Gaza. That Ministry of Health's data from previous conflicts and from this one have been studied by academics and found to be perfectly accurate. In fact, usually undercounts. So there's no reason to doubt them now. So there's at least 40,000 deaths from violence alone. It's very unlikely that many of those are Hamas fighters, just because the Hamas fighters who are killed probably aren't going to make it to hospitals. It's very, very unlikely. They're buried in tunnels, they're shredded in bombardments, things like that. But regardless of that, the main thing that we focused on was the deaths from starvation and complications of starvation. And I think it's important in this context to realize that starvation is not just it's not just an outcome of war, an accidental outcome of war. Which does happen. In this case, the starvation campaign is blatant and deliberate. There's barely any attempt to hide it on the part of the United States or Israel. It's perfectly out in the open. Human Rights Watch says that Israel is starving Gaza on purpose. Even Senator Van Hollen says that. So it's hardly controversial. So it makes sense to count those deaths as war deaths because the policy is deliberate. It's a choice, and using the Integrated Food Security Phase Classification data, which is the main technical group that monitors such things in the world, we looked at their data and we said that the minimum number of deaths that you can attribute to starvation in Gaza since October 7th, based on the available data, which admittedly isn't very good, is about 62,000. So overall, we estimated the number of the minimum. We said the minimum number of deaths that one can estimate at this point is 118,000.
Okay. Now we see in a new UN report out that it's accusing Israel of war crimes and crimes against humanity for its attack on healthcare facilities. Of course, Israel, we have to say, says it's taking precautions not to endanger civilian life. But what kind of conditions did you see when you were working in the hospital in Gaza?
So I was at European Hospital from March 25th to April 8th. It's on the southeastern edge of Khan Yunis. And Khan Yunis and Rafah hadn't been destroyed yet at that point. At that point, European Hospital was probably the best resourced city block in all of Gaza, and it was still an utter and total disaster. There were 10 to 15,000 people sheltering on the grounds of the hospital. The hospital itself was starved of supplies, barely had a water supply. There were many times when we didn't have running water because the available water had to be shunted to the operating room and the ICUs. And because the hospital itself was a displaced persons camp, and because it was a 220-bed hospital with almost 1,500 people admitted, it was just impossible to keep anything clean, to keep anything sterile. The entire population is displaced, of course. So even the healthcare workers, they're living at the hospital for the most part. The OR staff lived in the OR, the ICU staff lived in the ICU, et cetera. So you can imagine that cleanliness is basically impossibility. So operating conditions were impossible. Obstetric conditions were impossible. Infections from interventions, either surgical interventions or medical interventions, was just skyrocketing. It was close to 100%, from what I could tell, and others have said the same. The conditions in the hospital were horrendous. One of the things we did letter to the Biden administration that, like I said, me and 98 other healthcare professionals signed on October 2nd is that not a single one of us ever once saw anything that could even remotely be considered militarization of a hospital. Not once.
We know in any conflict, vulnerable people, children, pay the highest price. What have you and your other medical colleagues who've been to Gaza seen about children and how they're being treated?
Yeah, so children are universally considered innocents in war, even if they are somehow tricked, which is often the case, tricked into participating in military activity. So in those cases, it can be justified to target them, but nobody's really seen that in Gaza. What we have seen is widespread daily shooting of children, and I mean young children, pre-teenagers, in the head and chest. In that letter, and also in a New York Times article that I wrote 2 days ago, where I polled healthcare workers who've been to Gaza, what we discovered is that almost everyone who's been there and has worked in the appropriate settings, an emergency room, the operating room, the ICU, wherever it might be, regularly saw children shot in the head and chest. And again, small children, not teenagers. We saw them too, but I'm talking especially about young children, preteen children. When I was there, like I said, March 25th to April 8th, 14 days, I saw 13 children shot in the head. And it's important to remember, I'm not the one that they call when there's a child shot in the head. I just happened to be walking through the emergency room, where I happened to find them in the ICU the next day. So the targeting of children is very different from children just being so-called casualties of war here. It's very clear that they're being targeted. I'm a physician. I can't comment on this specific child or that specific child was targeted, but the overall, when on a daily basis, soldiers are shooting children in the head in a small place like Gaza, in the catchment area of every hospital in Gaza, on a daily basis, that's hardly an accident.
We saw a temporary pause today to allow the second phase of the polio vaccine campaign to take place in Gaza. That is one tiny bit of good news, would you see it?
Yes, absolutely. Better than nothing. Anything that stops the bombs from falling for even half a second is good.